Okay, now.
All right, today we're gonna be doing a demonstration of catheter insertion. So here we go. Good afternoon, how are we doing today? Can I get your name and date of birth? Looks like his name is Buddy Fundamentals, 9/14/1926. So I heard he had a little fall yesterday. Do you know what we're gonna be doing now today? Yeah, the doctor's ordered a catheter for you. Today, Buddy's getting a catheter because he's post-op, and many patients get that post-op. Other reasons would be any type of urinary retention. Enlarged prostate could be another reason as well. So I'm just gonna verify once that those are the correct doctor's orders, which they are, and I'm gonna go get that catheter for you. All right, got everything here. So before I open all this, I'm gonna create privacy for the patient, but that would get in the way of the camera, so I'm saying that I'm doing that. I'm pulling down the blankets and pulling up the gown. All right. Alright, and the outside of this is not sterile, so I can touch this with my hands currently. I'm going to open her up just like this. You have 2 inches to play with on the outside here too. So, just gonna open this up the best I can. All right, these are the gloves that it comes with, but they don't fit, so I'm gonna be throwing those away instead. Dr. Hyman has given me a separate pair of sterile gloves. These are a little bit different though. So, oh no, actually they look the same. There we go. These things are so done. There we go. And just like when we opened the catheter kit, we do have that 2 inches or that inch on the outside right there to play with. I'm gonna start with my right. And I can touch here because it's the inside of the glove. And I'm gonna put on my right glove first. Holy cow. There we go. All right. And now that this is a sterile hand, I can touch the outside of this glove. Make this easy. Holy cow. Okay, there we go. All right, so my hands are sterile right now, both of them. I'm gonna use this pad first to lay underneath there. I did it to where my hands are still sterile. I haven't touched anything except for the pad. Then we've got this one, which will go directly over the penis. Still, both hands are sterile. These we're not allowed to use on the mannequin. Normally, I would use these Q-tips in order to clean the tip of the penis, as well as this lubricant. Today we'll be using this lubricant instead, and a separate pair of Q-tips. CNA, do you mind grabbing my Q-tips out of my med cart? Thank you. All right. And what you're gonna do is you're gonna start from the tip and work your way out, so no bacteria or anything is getting inside of the head of the penis. So working the way out. Good. I'm gonna throw that away. And I'm gonna do it one more time for good measure. There we go. And that is clean. Sorry, we're gonna do it a third time. And one last time. There we go. Right. Okay, now for the catheter. First, I'm going to throw the urine cup away. I'm also going to utilize this lube for our patient. Okay, so. All right, now to set the catheter up, both of my hands are still sterile, so I'm allowed to touch all of this currently. I'm gonna take this plastic off. Okay, the patient is lubed up, and we're putting the solution, attaching that to the catheter here. And normally this would be lubed up as well, but because we're using a mannequin, it will not be today. We're gonna bring this whole thing and set it right on our workspace down here. Okay. So what I'm gonna do is my left hand will not be sterile anymore. I'm grabbing the penis in order to stabilize it while I insert the catheter. I will not be touching the head of the penis with my right hand though. So I'm gonna go until I see urine enter, and I see it going down there now. So I'm gonna go about another 2 inches. Here we go. And I'm gonna hold it with my left hand. At this point, I'm gonna put the solution into the bubble. There should be no resistance. Should go in nice and easily. Yeah, that's full. Okay, it's secured in there. It's secure. There we go. Just wanting to fill back up the syringe. Okay, and we would secure this by putting it lower on the bed down here. That way when it drains, it works with gravity. At this point, we would clean the patient up, and it's an indwelling catheter. We'd cover them up. We'd also do patient education, teaching them how to clean it appropriately, as we did before, starting the inside and working our way out. And we would also be teaching the patient about the risk for infection if they don't do that correctly. In order to take the indwelling catheter out, what we'll be doing is we're gonna use a syringe here, let her fill right back up. Empty that out. And once again, just to make sure there's nothing extra in there, and we're good. Okay, at that point, we just go ahead and tell the patient to cough. This is gonna allow the patient to kind of focus on something else, as well as kind of ignore or help them ignore the little bit of a pull. All right, go ahead and cough for me. Ready? 1, 2, 3. Good job. All right. That's how you put a catheter in. Thank you.